So I'm very, very pleased to introduce Alistair Duff today. Alistair is a consultant in psychology here in Leeds. I first met him earlier this year when he delivered a fantastic training session to us in improving patient outcomes. Now, Alistair was keen for me to point out that his clinical work is based mainly with helping people with cystic fibrosis and their families, rather than with CML directly. We've heard a lot about living with CML, living with a chronic disorder. I think there are obvious parallels with this and cystic fibrosis. And I think you'll find what Alistair has to say very, very relevant.
Thanks, Kate. Straight down. Yeah. Well, thanks for inviting me to speak. I feel very privileged to share some of these thoughts with you. And I always take talking to patients, parents, very seriously. It's a great opportunity to share our ideas as psychologists, and contrary to the title that's in the programme, you might have noticed I've changed it. And this is something that I changed sort of last minute, really, to try and not marry up what I think I know in cystic fibrosis to how you live your lives or how you parent somebody that's got CML, but a strategy that is becoming very prevalent and very popular in working with patients and parents who've got all types of chronic conditions, and that's something called acceptance and commitment therapy. Have people heard of acceptance and commitment therapy at all? Have people? One. Good. I'll ask questions later then, or if I get stuck, you can help me out. And you'll have heard of mindfulness. Everybody heard of mindfulness? I saw a bit of mindfulness or Tai Chi going on over lunch. Mindfulness is part of this, but it's an adaptation of mindfulness that I want to try and share with you. So I'll crack on. I live in the middle of this Venn diagram where you've got X amount of people, 16.5 million of us living with chronic conditions of some sort, and you've got about 9 million of us living with mental health conditions. And it's in this sort of intersection of mental health and physical health that myself and my colleagues find ourselves working. But to take a mental health approach to living with a physical condition is often the wrong place to start. Often having another diagnosis of anxiety and depression or obsessive compulsiveness or needle phobia, isn't that helpful in living with a disease? Very often in living with a disease, it's a normal emotional psychological response to very difficult circumstances, difficult treatments, difficult impacts on people's lives. And so this is where particularly I've found this approach incredibly useful. I've come late to this. This is an approach that's been around since the late 90s. But it has its roots in helping people live with long-term conditions. And it's an acceptance of what has happened to us is the first step in overcoming the consequences of what has happened to us. It's about being willing to accept what's happened to us and adapt to what's happened to us in the sense of, I don't like this, I don't like cystic fibrosis, I don't like CML, but yet here it is. It's not going away. How do I move on from that? Certainly, accepting CML or accepting CF does not mean give up. That's a common misconception at the outset. Or acceptance and commitment, well, you're just giving up. We're not going to be stepping into clinical trials and trying to find some kind of way forward with sort of productive sort of pharmacology. It's are we willing to live with it in our lives and accept that it's not what has happened to us or is happening to us, but it's that internal experience of it. And then we've got to learn somehow to change that narrative. So finding the solution is something we need to let go. We need to let go of that struggle to purely find the solution, because it's that energy that leaves us feeling broken. It leaves us feeling that we're different or we're not normal. You know, happy, healthy normality is a myth. Happy Valley is a myth. It's about how do we learn to accept what's happened to us in a way that we can continue with what's important to our lives in accordance with our values. Now that sounds very, very spiritual or if you like, sort of difficult to grasp a hold of in real life, but I promise you that this stuff is very practical. What's the movie here? Inside Out. Hands up, who's seen Inside Out? Oh, very few. Oh, very few. So this talk's got 2 recommendations. 1 film, 1 book. Go see this film. Get together as a group and you'll see just how alive feelings and thoughts can be in people's heads. And it gives a very, very good depiction of how we need to separate out from those thoughts dominating how we live our lives to being able to tolerate those thoughts being there without us necessarily seeing the world through those thoughts. Those thoughts will lead to certain feelings and behaviours. Sometimes those thoughts and feelings and behaviours can be the problem rather than the problem itself. Does that make sense? I hope you're still with me. That's my first recommendation. Watch Inside Out. So we've got difficult thoughts and feelings to live with, but we've also got difficult thoughts because it's our mind's job to look after us, to look out for possible dangers ahead, to try and solve the problems that might come up, to try and remind us of things that are really important to us, and to remind us of things that are important in our lives that are missing. It's important that we don't forget what is important in our lives and trying to keep track of how people are treating us. That is why some of these thoughts are difficult. But it's how we react to these thoughts that sometimes gets us into trouble. Sometimes we give up on things because we've got CML or cystic fibrosis. We don't believe that we can engage with what we thought we could do at one point. We've become absorbed with those thoughts. We live in the past rather than trying to accept that we've got to adapt to a new future. We try to solve problems that simply can't be solved. And we put a lot of energy into distracting ourselves from that discomfort. And we avoid things that make us feel bad. That is the human condition. We would naturally want to avoid stuff that doesn't make us feel good. And that's what we call in acceptance and commitment experiential avoidance. But we need to adapt. We need to adapt because it isn't, you'll know this quote, it isn't the strongest or the brightest people that survive in Darwin's theory. It was the ones who were most responsive to change. And again, in how we adapt and being responsive to change, we need to try and put the energy into dealing with those thoughts and feelings, into living with those thoughts and feelings and moving ahead. So if we want to change, we've got to lose the distinction between the thoughts and the feelings as reality. And yes, they still live here. They're here, and our brains will remind us of these thoughts and feelings, but we can continue to engage with our lives in accordance with our values. If I had more than 20 minutes, I'd probably spend an hour with you talking about how we reconnect with our values, how we want other people to see us, how we believe we would like to live our lives, what we believe that we commit to in the world in terms of how we interact with other people would be our values. It's a massive part of this, and it's really the foundation of living your life well in accordance with your values. So we can still do that, but we still got to be able to tolerate these difficult thoughts and feelings. The next part of acceptance and commitment therapy is trying to understand how we've fused with those thoughts and feelings. So we are seeing the world through the thoughts and feelings rather than the world containing those thoughts and feelings. They're part of your world. It's like wearing green tinted specs. Everything is green rather than being able to see that you've got the specs on, so you see the specs that are there. But how do we reduce them influencing everything that we see, do and feel? So for example, I might have the thought that I'm a burden to my family. So adult cystic fibrosis patients would tell me this. I'm not going to see my kids get married. My kids are going to have to learn to live without me. So these were quotes and thoughts from some of my older patients from cystic fibrosis. We would spend a portion of the time in our work really trying to get in touch with how those thoughts make us feel, what we do in response to these thoughts, how we behave once we have these thoughts. And then really what the next process is the first stage in the repair work and trying to defuse this. So the only thing that is different to this slide is that you précis the thought with, I am having the thought that I'm a burden to my family. I'm having the thought that I'm not going to see my children get married. I'm having the thought that my kids are going to have to learn to live without me. And it slowly starts to uncouple the sense that that thought necessarily needs to drive everything that you do and everything that you feel. And that part of acceptance and commitment therapy is called diffusion. So it's something that I'm compressing into 5 or 10 minutes to explain and give you a kind of narrative explanation of how the therapy works. But it's how it influences a range of ways in which we live our life. People have adapted this now into kind of different challenging problems. They've adapted it into careers management, sports psychology. So it started off in helping people live lives with chronic conditions and really is beginning to become almost like a framework for how we might live our lives positively. It's got its roots in behavioural psychology. You might remember sort of your Pavlovs and your Skinner's conditioning. Those were theorists that thought our lives were all about how we behave. There was a sort of a cognitive revolution that sort of showed that how thoughts will influence our behaviours. And you will obviously have heard about CBT. It's the most popular form of psychological therapy, cognitive and behavioural psychotherapies. But in that therapy, and people often seek that out as a kind of a therapy to try and help them live their lives. But the premise of some of the cognitive behaviour therapies is that it challenges the thoughts as irrational. Now, if you go back to these thoughts, some of these thoughts might not be irrational. They are very rational in the context of what is happening to people in their lives. And so, although people may seek out cognitive behaviour therapy, my experience is that it's often not the right answer to help people get unstuck from where they are. Does that make sense? It's about not challenging those thoughts as irrational. It's about absorbing the thoughts and keeping them here as we move forward. Yes, they're still here. Yes, they're still present. But can I still be with you in the room and tolerate this discomfort whilst I talk to you all and you have some questions for me? Does that make sense? So this is my second recommendation is the book. And the two key names to kind of remember in acceptance and commitment therapy is Steve Hayes and Ross Harris. Steve Hayes was really one of the original architects of this, and he writes very much for professionals, and his texts are all for professionals. Ross Harris is a professional. He's a professional psychotherapist, but his books are much more open to a general population. I wouldn't quite say they're self-help, but when I am working with trainees, it's his book that I recommend. It is very, very accessible, and you very quickly get into the modality of acceptance and commitment therapy. I did think about kind of rattling a few slides together about the evidence. You know, why am I trying to sell this to you? Why am I introducing this to you? Well, it is effective. There's now over 300 randomized controlled trials on acting long-term conditions. The emphasis has been on the change processes which lead to the change outcomes. So the outcomes have always been about people's change in their lives. Meta-analyses of these 300 or so randomized control trials and some other smaller good studies have all shown really positive results. That's probably one of my favourite studies if you ever wanted to follow up the reference, but almost all the research can be found kind of linking through from this website if that was something you were interested in following up about. And it's now so well accepted as an evidence-based psychotherapy that it's really got on to the kind of US Department of Health list of evidence-based psychotherapies. So although I'm not showing you the primary data from the original studies and showing you the outcome statistics with the error bars, you'll find that on those websites, and I hope you'll convince me that I'm telling you the truth. The first 10,000 trial participants included a lot of people with cancers, all forms of cancers. Most of the work was designed with pain, and it was really established within pain clinics as the modality of choice once we'd reached the end of the road of pharmacology. It was about trying to help people live their lives with chronic pain in the absence of a way forward, sort of pharmacologically or medically. And it quickly then adapted into other long-term conditions. You see it's pain, cancer, and epilepsy. These are the big studies, but as I say, it's really gathering a lot of traction all across long-term conditions. So we are trying to accept and we are trying to commit. And this is why our dogs, if you've got any dog owners here? Yeah, still a minority, but if you've had a dog or you've got a dog, you'll know that happiness is right in front of you. They're just happy to see their kind of grown up. And very often, I often think that when you look at a dog greeting its owner for the first time, that is act in a nutshell. Or a toddler eating an ice cream. Nothing else exists in that minute other than that ice cream or that owner. But we are sophisticated, cognitive, emotional human beings. And we carry with us our lives. And often it's our lives and the problems in our lives that colour the view that we are looking at. Or it prevents us from looking at what we want or achieving what we can. And this is where the mindfulness bit comes in. Now, I am a fan of mindfulness. I don't want you to get the wrong end of the stick that I'm being critical of mindfulness. But mindfulness isn't about achieving this. It's not about potentially a version of what I saw upstairs in that you're trying to create a Zen-like feeling that is dissociated from real life. Very often, mindfulness is practiced in calming environments, nice gravel pit, piles of stones, looking at a beautiful sunset. It's about being present, but it's about being in the present reality. Okay? You know you've really sort of hit the mark when Ladybird produced a book, and this is taken from the Ladybird Book of Mindfulness as a skit on what mindfulness is. But actually, I think they've hit the nail on the head here. I think that they've hit the point of what mindfulness should be about, in that we should be able to become mindful in our real lives, whether that is outside listening to dubstep coming from a souped-up impreza. Does that make sense? And so when I teach kids how to relax, I often teach kids, I teach adults how to cope with difficult procedures, often involving needles, MRI scanners. I don't use tapes, I don't use videos, I don't use DVDs. I teach them how to control their autonomic arousal, and I teach them how to imagine. For young kids, I get them to imagine, a free trolley dash in a toy shop, or they're watching a big TV with the best video games on it. Adults, you might get them to imagine a beach, but they've got to be able to access that image in the real world, in the MRI scanner, not in a kind of a spiritual place with the environment that is removed from their reality. So that is a really important part of acceptance and commitment therapy. It's about getting into the present, but the present has to be in reality. So this cartoon is what we're aiming for. Yes, our baggage and our thoughts and our pain and our feelings are still with us, but they are thoughts and feelings. They are there, and the energy that we put into them must be diverted into the energy of still seeing what's in front of us. Does that make sense? So if that all makes sense, and I can borrow 2 minutes, I'm going to do a little bit of a group exercise. You would expect that from a psychologist, wouldn't you? I'm playing right into the stereotype of a psychologist. But I'm not going to ask us all to kind of sit in a circle and hold hands. I'm just going to ask you, this exercise in ACT World, this metaphor is called passengers on a bus, okay? And I want, I'm looking at my bus driver down here. You happy to be my bus driver? You don't need to do anything. You don't need to move. You're the bus drivers. You're the passengers, okay? You've got control of this bus. You can take it wherever you want, all right? Unlimited, free travel. Where do you fancy going? You go to the seaside. Anyone else want to go to the seaside on a day like today? All right. Yeah, there's a few people, but he doesn't want to go. He wants to go down the pub. He's had enough. Okay? He's had enough. So what are you going to say to her? She's taking you off to the seaside. You don't want to go. What are you going to say?
I know what's up in the pub. I just want to make sure the seaside's the right sort of seaside.
Yeah. So you're getting a bit of gyp now. You want to go down a road and everyone is going to go, oof, you're never going to get that down there. There's a low bridge down there. You don't want to go down there. So how would all this start to feel? Actually, some of these people don't want to go to your seaside. They don't want to go down this road. What are you going to do? So you change direction. You listen to them. And what if they start getting a bit rowdy? No, we don't want to go down here. Starting a bit. Or you come to a compromise. Okay. So you still don't get to where you want to go. So you give up on where you were going. Okay. Anybody? Let's help them out. What else? If you're the driver of the bus and your passengers are all getting on, they're getting a bit shirty. Anybody want to kick them off? Get off, yeah. So while you're kicking them off, of course, the journey's stopped. Whilst you're compromising, the journey's changed. Does this start to make sense? Is this metaphor starting to come to life a wee bit? That actually, some of the passengers that we carry around with us on our bus deflect our energy from where we want to go. We spend all the time, if you like, dealing with them, kicking them off, compromising, telling them to shut up. Yeah, agreeing, disagreeing, that deflects you from where you want to go. So the energy that you're putting into dealing with your unruly passengers could be better spent on, actually, okay, I can hear you. I can hear you want to go to the pub. I can hear you don't want to come down here. I hear you don't want to go down there. I can hear it all. Thanks a lot. But I'm keeping going. Does that make sense? And that kind of metaphor really is the kind of the essence. It's act in a nutshell. So to summarize seriously, we all move through life. We've all got difficult thoughts and difficult feelings, and they will always show up because that is just how we are hardwired. They validate our experiences, and our experiences validate those thoughts as well. Often these are unpleasant when we're faced with difficult things, traumatic things, loss, but the thoughts in themselves are not harmful. We've got a natural urge to struggle with them, to fix them, to get rid of them, to avoid them. And it's the way we go about this that often can lead us more distressed than the thoughts in the first place. And so in ACT, the goal isn't to reduce them, but to enable us to do the things that matter to us in our lives in accordance with our values. Again, I've jumped that section, but it is colossal. Living a life well is often a life lived according to our values. So I've hopefully introduced ACT to you. If you want to know more about it, my email's at the bottom here. I'm probably not the best seller yet of ACT because I'm only just halfway through my training myself, but I'm finding it very useful with my patient group. And I've talked to it with my patient group and explained it. We have an annual parents event, something like this, every year for our CF patients. And the more we talk about it, the more people are starting to ask for us to start to run small groups on it. So I'm very happy to talk about this stuff or any other kind of approaches to difficulties in living with this. But thanks for inviting me. I hope I've kept roughly-ish to time. Thanks.